Hi everybody, I'm Dr. Nicole Robinson and I'm a doctor of pharmacy and a certified functional medicine practitioner with Synergy Chiropractic Center. Now this video is the first in a series of 4 that are focused on natural ways to support your body when you're preparing to have a baby. Now if you haven't watched it yet, the introduction to this series is called the Functional Medicine Approach to Fertility. Now in that video, I give you some background information that's helpful to learn before you dive into this series of supportive therapies. So let's start with nutrition. Now I always recommend that's where you begin when you are trying to optimize your health. So in regards to fertility, when should you start? Well, if conceiving is your motivation to get healthy, then your body ideally needs about 5 to 6 months to prep. So this might seem like a long time, but this is the best time frame to get your body ready to create a tiny human. And this goes for both the mom and the dad to be, so keep that in mind. Now once you decide to change your diet, where do you start? So caffeine and alcohol, unfortunately, have been shown to actually affect the quality of the sperm and the egg that will go on to form the baby. So limiting these things can have a positive effect on development. Now, I don't think you need to cut these out completely, but coffee, I would say probably no more than a cup a day. Energy drinks, 0. Energy drinks are garbage. And alcohol, no more than 2 drinks a week. Let's talk food. So we're gonna start with foods that you should be avoiding. So the top of the list is gluten. Gluten really is very inflammatory for a lot of people, even if you don't have a specific allergy or intolerance to gluten. There's a lot of evidence building against it. It usually has a lot of pesticides and herbicides sprayed on it. So gluten, number 1, avoid that. Raw or undercooked meat or eggs is just because it puts you at risk for a bacterial or parasitic infection. And if your body is fighting something, it is probably less likely to have the extra energy to be producing, an egg or a sperm or to support pregnancy. Non-organic corn is also kind of like gluten. It's very heavily sprayed with pesticides and herbicides. Soy is controversial. So there are some studies that show it's beneficial. Some show that it's dangerous. If you're going to have it, have fermented soy. Unfermented soy has a lot of the nutrients taken out of it through the processing. So avoid that. Commercially prepared milk is similar. The pasteurization process kind of takes a lot of the good stuff out of it, and it takes the beneficial bacteria out, so it can be harder to digest. Non-organic tea and coffee, kind of like corn, very heavily sprayed. Just stick with organic. Excessive fish is due to the mercury content that can be in a lot of fish. So I wouldn't have it every day, but if you want to have it once or twice a week, that's fine. Fried food is another one. And then at the bottom is artificial sweeteners or processed sugars. I think those two, most people know and recognize the dangers of those. Fried food, the oils that they use to process that, it's too hard for our body to break down and use, and it just ends up being kind of dirty fuel that it doesn't help us stay healthy, basically. And then sugar is always at the top of my list. To me, it's the most dangerous thing out there as far as what we're eating. It causes cancer cells to grow. It, messes up insulin. It's just bad. So if you can avoid processed sugar, do that as much as you can. If you need to get a sugar fix, try to stick with natural sweeteners like honey and fruit. I also have a list of foods to include on a little bit more of a positive note here. So at the top, protein. Seriously, protein is probably the biggest thing that you want to include. That's huge for developing a tiny human. Saturated fat is going to be important too. That is kind of the building blocks of cells, is cholesterol or saturated fat. And you can find that in avocados, nuts and seeds, olives, Organic fruits and vegetables. You want to go organic if you can. There are some studies showing that fruits and vegetables that are organic are actually higher in nutrients. The ones with stars by them are actually specific vitamins, minerals, nutrients that are important for growing and developing. So it would be important for the developing fetus. So iron-rich food, red meat, and leafy greens. Folate-rich food, again, leafy greens, and then some specific fruits and vegetables, along with beans and nuts and seeds. B vitamin-rich food is where you have some of your dairy, eggs, leafy greens again, salmon, red meat again. Choline is really important for development as well. Eggs, fish, and red meat. And antioxidant-rich foods. Most fruits and vegetables are high in antioxidants. At the top of the list, though, are berries. Chocolate, as long as it's bitter, so it needs to be at least 80% cacao, has a lot of antioxidants. And then green tea as well. And then at the bottom, anti-inflammatory food. So some spices there, ginger and turmeric have a lot of anti-inflammatory properties. Those are at the top of the list. And then apples as well. But you will get some, most fruits and vegetables are anti-inflammatory unless you have some type of sensitivity to them. Optimizing your diet is a big step to take. And it can be really hard to do, but it's one that can pay off too. Because we want you to be the healthiest that you can be. Okay, your body knows when it's not ready for a baby. If you give it the right support, your body can do amazing things. And you'd be really surprised at what a few months of clean eating can do. I know that I was. Thanks for watching and have a fantastic day.